Hi, good evening, and welcome back to this histology slide discussion sessions that we have on every Thursday. If you remember, we had started with the discussion of the slides of systemic histology, and we started with digestive system. We discussed the slide of esophagus to begin with. Then we discussed the slides of the stomach. Today, we'll discuss about the slides of the small intestine, right? If stomach is the site where the larger food particles are broken down by the process of digestion, the intestines are the places where the food is absorbed, the nutrients are absorbed. Small intestine, the site of absorption of nutrients. Large intestine is mainly the site of absorption of water. Now, in order to absorb food, the mucosa of small intestine undergoes modifications. What modifications? Modifications which include increased surface area of absorption, right? So how exactly the surface area of absorption of small intestine is increased? So let's try and learn what are the factors that actually enhance the area of absorption. The first one is the length, right? The length of the small intestine is roughly about 6 meters, and this greatly enhances the absorption of nutrients. Right? Just a minute. Yeah. One, length. Then there are mucosal folds, right? So the mucosa itself is thrown into folds. The third thing is villi, and the fourth thing is microvilli. We will learn what exactly are villi and microvilli as we go forward. So these are the factors which will enhance the area of absorption of the small intestine. Of course, length is consistent, 6 meters in everybody, right? Mucosal folds, villi and microvilli will further enhance the absorption or absorption capacity of small intestine. As we know, small intestine is divided into 3 parts. The proximal part, which is called as the duodenum, right? The middle part, which is called as the jejunum, and the terminal part, which is referred to as the ileum. Done. So these are the 3 major parts of the small intestine. And let's start a discussion with the slide of the duodenum. Again, the duodenum will contain 4 layers. So this is mucosa. This is the submucosa. Here we have the muscularis externa, and lastly we have the serosa. Remember, the duodenum, right, except for proximal 1 inch, is retroduodenal. I'm sorry, retroperitoneal, right? Initial 1 inch is covered by the peritoneum of the stomach. Rest of the duodenum goes behind the peritoneum. So only the anterior surface and the sides of the duodenum is covered by the peritoneum or the serosa. The posterior surface will have adventitia. Right? Done. Now, these 4 layers are similar to any other layer that we will see in GIT. 4 layers: mucosa, submucosa, muscularis externa, serosa. Now, what are the characteristic features? The first characteristic feature we will observe is these finger-like projections. Okay? Now, what exactly are these finger-like projections? These finger-like projections are what we refer to as villi. So if the surface epithelium is like this, resting on a basement membrane, the villi actually form as a projection. Okay? And the columnar cells which line the mucosa of the small intestine continue to line it. This is a villi. Okay? So the typical feature of small intestine is presence of finger-like projections called as villi. Villi are absent in stomach. Villi are absent in large intestine. Villi are present only in small intestine. Right? Done. So this is villi. These villi, when they invaginate below the level of the surface epithelium, and they further get lined by your columnar cells. We will call these as the crypts crypts of Lieberkühn or glands of Lieberkühn. These are basically intestinal glands. So all these sections that we see here, all these round sections that you see, right? All these are intestinal glands. So this is the first thing I want you to understand. What is the difference between villi and intestinal crypts or glands? Villi, remember, they emerge from the surface. So in simple terms, villi are like mountains. You have ground level, and on top of that you have mountain, that is a villi. Now, if we go deep to the ground level, right? Let's imagine we are thinking about a well, right? Well is an example for an intestinal gland. Are we clear? So what is the peculiar feature of the villi of duodenum? The villi of duodenum typically are described as leaf-shaped. These are broad, right? Broad and leaf-shaped villi with intestinal crypts. This is the feature. Each of these villi and intestinal crypts are lined by what we call as simple columnar epithelium with microvilli. Now, here we are coming across the term microvilli. Now, what do I mean by the term microvilli? Remember, if I take one columnar cell, so a simple columnar cell will look like this. It will have a nucleus. But if I'm talking about an epithelium with microvilli, the apical portion of this will be thrown into number of folds. And here we will have nucleus. Compare the surface area here and surface area here. So here the surface area is greatly increased because of the folds. So remember, microvilli are universally found in areas where the primary function is absorption. What is the function of small intestine? Absorption. That is why small intestine epithelium will have microvilli. This is how you need to correlate the structure of duodenum with its function. Done? Right. So when I started discussion, I directly jumped into the layers. Now, let's imagine you get this as the slide of discussion for you in your exams. How would you proceed? The first answer you say is, sir, this is the slide of duodenum. Then the examiner would ask, how do you justify or how did you say? Then you will say, sir, I can make out 4 layers: mucosa, submucosa, muscularis externa, and serosa. Are we clear? Right. Now, you start describing the mucosa first. The examiner will ask, okay, fine, these layers are found in all the slides of the GIT. Then what makes this peculiar? Then you will say, sir, mucosa shows broad leaf-shaped epithelium with intestinal crypts. The submucosa shows characteristic Brunner's glands or submucosal glands. This made me say that the slide is duodenum. Then the examiner will ask, explain the slide in detail, and you can go on explaining the slide in detail now. So we discussed about mucosa. Then the thin muscularis mucosa, if you observe, is clearly visible here. Can you see this layer? This is the muscularis mucosa, which forms a clear demarcation between the mucosa and submucosa. We will go back to the slide of the stomach. Here also we had a very peculiar muscularis mucosa, right? If you observe here, here also there is a very peculiar muscularis mucosa, right? Now, this muscularis mucosa is a layer of smooth muscle which will separate mucosa and submucosa. Done. The examiner will be more interested in this layer, which is the submucosa, which is made up of glands which are called as the Brunner's glands. Now, what are Brunner's glands? These are submucosal glands. These secrete mucus which will neutralize the acidity of the pylorus of the stomach, hence protecting your small intestine from the harmful effects of the hydrochloric acid secreted in the stomach. So presence of submucosal glands of Brunner is the characteristic feature of duodenum. If you want to say the slide is duodenum, you must have Brunner's glands. Done? Right. Then the next layer we have is the muscularis externa, which is divided into the inner circular and outer longitudinal layer. And in between, we can see mesenteric plexus. The last layer we will have a serosa. So muscularis externa and serosa, remember, are unremarkable, right? The serosa in case of duodenum, we must remember, is present uniformly in the first 1 inch. In rest of the duodenum, it is present only on the front and the sides, whereas the posterior surface of the duodenum is covered by adventitia. There is no serosa. Why? Because duodenum is a secondarily retroperitoneal organ. It is covered by the peritoneum only on the front and the side, so there is no peritoneum posteriorly. Done? Right. This is regarding the slide of duodenum. Done. If you get this slide, this is the slide of jejunum. Again, the question is, how do you say that this is the slide of jejunum? Now here, what I want you to focus is, I want you to focus on these long finger-shaped villi. So all these are finger-shaped villi, long finger-shaped villi. This is the characteristic feature of, so what is this? This is the long finger-shaped villi, right? Which is the characteristic feature of what slide? The slide of jejunum. And what is the slide did we discuss here? This is the slide of the duodenum. Done? Now, what are the other features that will help you from differentiating this from the slide of duodenum or from the slide of ileum? Long finger-shaped villi, done. We can see intestinal glands which are in plenty, fine. We can see thick muscularis mucosa separating mucosa, submucosa, fine. But focus here, which is the characteristic feature we need to look for. The submucosa contains dense connective tissue and nothing else. There is absolutely nothing in submucosa except for dense connective tissue, few blood vessels, few nerves, few lymphatics. Done? Right. So, unremarkable submucosa is one of the characteristic feature of jejunum with its finger-shaped villi. The muscularis externa is the same inner circular, outer longitudinal. Jejunum and ileum, remember, are intraperitoneal organs and hence they are covered by peritoneum all around and hence they will have serosa all around. There is no adventitia. Right? Only in duodenum, only in the proximal 1 inch, you have serosa. In rest, you have serosa on the front and the sides. Posteriorly, you will have adventitia. Done? So, if the examiner asks, how did you differentiate or identify this slide as jejunum? What will be your answer? Sir, I still can see 4 layers of GIT: mucosa, submucosa, muscularis externa, and serosa. Mucosa shows long finger-shaped villi, which are characteristic of jejunum. The submucosa contains only dense connective tissue and rest of the features are unremarkable. And hence I would go with this is jejunum. If the examiner asks why this is not duodenum, your answer would be the submucosa contain no Brunner's glands. If the examiner asks why this is not ileum, then your answer will be the submucosa does not contain Peyer's patches. What are Peyer's patches? We will see later. Right? The examiner might ask why this is not stomach. Stomach never contains villi. Stomach contains what? Gastric pits. So if you want to go back, this is gastric pit. This is a pit. This is a gastric pit. This is a gastric pit and this is a gland. Shallow gastric pit is the characteristic feature of the fundus. Did you get it? Right? GI slides are slightly confusing, but if you apply your mind and identify these differences, they are absolutely easy. Right? Done. The last slide here would be the slide of ileum. Now, what is the characteristic feature of ileum? If you take a look, the ileum is studded with Peyer's patches. So first, this is the slide of ileum. So we have Peyer's patch. What are Peyer's patch? These are lymphatic nodules. Where they are present in the submucosa. Right? Now, if you observe the villi, these are blunt, short. Right? You can even use the word thin. Thin, blunt, short villi are the characteristic feature of the ileum. But the characteristic feature of ileum that you must never forget is this whole area, which is the Peyer's patch, right? The lymphatic nodules. Remember, these lymphatic nodules are present only along anti-mesenteric border. If the examiner wants to make your life difficult in spotters, if you want to make your own life difficult, if you don't focus the anti-mesenteric border, you will never find the Peyer's patches. Then you might go wrong in identification of the slide. This is why it is mandatory whenever you get a slide, scan the whole slide thoroughly. See every field before you come to a conclusion, because in discussion, you will have ample time to see the slide. 1 or 2 minutes are more than enough to scan the whole slide to get it correct. Okay. So never make that mistake of jumping into conclusion that this is the slide of duodenum, this is the slide of jejunum without looking at the whole area. Am I clear? Right. So this is regarding how do we identify ileum. Rest of the features again are unremarkable. If you observe, we can see, just a minute, this is the muscularis mucosa we are looking at. Okay. Sometimes these Peyer's patches can extend into the lamina propria, but invariably these are found in submucosa. Right? So if you get slide of small intestine, this is how you must identify. Let's recall all the slides together once. The slide of duodenum is made up of 4 layers. The mucosa, submucosa, muscularis externa, serosa, and adventitia as well. The muscular layer, the mucosal layer, contains 3 layers again. What are they? Lining epithelium, lamina propria, muscularis mucosa. The lining epithelium is thrown into number of folds which are called as villi. Each villi is lined by what structures? Each villi is lined by the simple columnar epithelium with microvilli. How do we say that this is the slide of the duodenum? Duodenum has broad leaf-shaped villi with intestinal crypts. The characteristic feature is presence of the submucosal glands, submucosal Brenner's gland. This is the characteristic feature. Then the muscularis externa contains inner circular and outer longitudinal layer, and then we have the layer of serosa. Are we clear? So this is regarding the layers of the duodenum. Now, how do we identify the slide of jejunum? Remember, jejunum contains long finger-shaped villi, right? Long finger-shaped villi with unremarkable mucosa. How do we identify ileum? Ileum contains Peyer's patches which are submucosal lymphatic nodules. Are we clear? So this is how we must identify the slides of duodenum, jejunum, and ileum. If there are any doubts with respect to whatever we have discussed till now, please do let me know. I'll try to clarify before we close. If there are no doubts, we will come back again next week with the slide discussion of large intestine. Once again, we'll compare small intestine slides with large intestine as we compared the slides of the small intestine with the stomach today. Right? So until then, have a great weekend and study well. Thank you.